Good day everyone. I am Ayushi Parekh from Mayo Clinic, Florida. I am a research trainee in the Department of Critical Care Medicine. Today I am going to present our abstract on prediction of cytokine release syndrome in diffuse large B-cell lymphoma patients receiving CAR T cell therapy using the modified EASIX scores. As we all know that CAR T has shown promising remissions in patients with advanced hematological cancers. What we tried to do in this study, in this retrospective study, was to use the endothelial activation and stress index, that is EASIX score, in predicting the CRS in several oncological diseases. We had a cohort of 214 CAR T adult patients which were admitted to Mayo Clinic between 2019 and 2021. We then further analyzed these patients, calculating their EASIX scores with the help of CRP, LDH, creatinine and platelets values via their electronic health records 7 days before and after the CAR T therapy. We use these values to calculate different types of EASIX scores, say S and M. Moving on, discrimination was measured of these scores with the help of area under the curve, and we compared each score between patients treated for DLBCL and multiple myeloma. The optimal cutoff values were determined using the UDENS indexes. As we can see in the graphs that out of these patients, 42.5% has had DLBCL and 28.5% that were included had multiple myeloma. Based on the UDENS index, the optimal cutoff value for EASIX was 2 with a sensitivity of 83.33% and the specificity of 58.33%. for predicting the CRS in patients with DLBCL. However, in patients with multiple myeloma, none of these proved useful. If you look on your right side, you can see that in the area under the curve for DLBCL, we noted that MEASIX had an area under the curve of 0.77 and EASIX had 0.78 in DLBCL patients. In conclusion, I would like to say that EASIX is an easy to calculate score, and we observed that it had a high discrimination to predict CRS in patients with DLBCL after lymphodepletion. However, EASIX scores were not very useful in patients with multiple myeloma. Thank you. Have a wonderful day.